Hello, everyone. It's a pleasure to be here with you. Technology all of this today. I'm here so far talking from Brazil, and I want to thank Masha and the entire ProfMed team for the invitation. Let's start. I'm Professor Tatiana de Liberador, and I have Master and PhD in Periodontics. I'm currently professor at Latin American Institute Dental Research and Education, ILAPEL, in Curitiba, Brazil. Since 2002, I'm a private practice in periodontology and oral implantology. And since 2018, I'm part of International Board of Bluem. During my career, my team and I did a lot of research and clinical cases using Bluem products. And today, we will talk about how to optimize your clinical outcomes using topical oxygen therapy. But before starting, I want to present to you the Bluem institutional video. Let's watch this video.
This is our story. This is our soul. Our average lifespan is 80 years. There was life before us, and there will be life after us. Our lives represent only a fraction of the total time. There are only two ways to live your life. One is as though nothing is a miracle. The other is as though everything is a miracle. We live as though everything is a miracle. Nature, breath, oxygen, heartbeat, love, sunrise, birth. To us, life is a miracle. Oral health, the window to our overall health. Our mouth is the entry point to our digestive, respiratory, and nervous system, and therefore crucial for the quality and quantity of our lives. We are Bluem, a leading oral health brand. We elevate health and well-being through oral care. We create revolutionary oral care essentials for day-to-day life. We have a 10-year-plus proven track record supplying dental professionals, setting a whole new standard in the industry. Today, our award-winning products are available in over 50 countries worldwide, benefiting us and the world we live in. Elevate life at bluemcare.com.
Okay, let's start my presentation, present what Bluem products are. We have 5 products. The first one, toothpaste. The second one, mouthwash. We have a foam, we have a fluid, and we have oral gel. And the secret of Bluem products is the slow release of active oxygen. Bluem has a unique formula, and oxygen sources come from 2 sources: honey, GOX enzyme, and sodium perborate. The bees have a secret. The bees work and release this enzyme, GOX enzyme. And the sodium perborate and the GOX enzyme, when in contact with oral fluid or blood, release the hydroxygen peroxidase. This is the source of oxygen. And the oxygen released and is low doses, is low concentration, not harmful to tissue. This is important information. The role of oxygen in wound healing is well described in the literature. The oxygen is present in all phases of the healing process: coagulation, inflammation, remodeling, and proliferation. And in all phases, oxygen acts. It's important. And all products of Bluem have oxygen release, but in different concentration. The mouthwash, toothpaste, and Bluem release lower concentration of oxygen. The fluid release 2 times more oxygen than the other one. And the oral gel release 5 times more oxygen. This is the principal difference between products, okay? Let's talk about research. We have a lot of researchers made with Bluem products. And the first research that I talk to you is use of oral gel. And now I need your attention. Oral gel does not contain fluoride, does not contain alcohol, and is laurel-free, that promotes less mucous dryness. It's important information, and the main indication for the oral gel is to have a healing and bactericidal action. The oral gel helps healing because the release of oxygen, okay? This is important information. The first research is about oxygen releasing agent promotes healing of skin wounds in rats. Let's see. The objective of this research was evaluate the local effect of slow oxygen release gel on the healing of standardized skin wound caused in rats. It's a histological and immunohistochemical research. The animals was divided in 2 groups. The test group, the oxygen gel were applied on the wounds on alternative days 4 to 8 days. And the control group, distilled water were applied on the wounds on alternative days 4 to 8 days too. Here we can see these wounds, okay? It's a big wounds. And the results were incredible for me. The clinical results show that, look to the picture, group T, Bluem group, showed better healing at 10, 14, 21, and 28 days, better than control group. Histological result shows that have more angiogenesis, increased angiogenesis, increased granulation tissue formation, and deposition of collagen fibers than group C. The healing is better too, okay? This is important information. The gel promotes better healing. And the immunohistological analysis show the presence of TNF and VEGF in both groups, but the levels were significantly higher in the group T. This research proves that oral gel has angiogenic action and stimulates the formation of collagen fibers, or the oral gel has an important role in the cicatrization. And here we have this research to prove these things, okay? This article was recently published under my authorship and other colleagues in 2023. Another secret of the Bluem formula is lactoferrin. Lactoferrin also plays an important role in angiogenesis and the formation of collagen fibers, which are key points for better tissue healing. This article concludes and says that lactoferrin can accelerate the healing process in gingival wounds. Okay. The second research, we will talk about periodontitis. This study was conducted by Dr. Niveda and Dr. Karthikeyan from India. This study compared the effect of oxygen release oral gel and the chlorhexidine gel in the treatment of periodontitis. The patients were divided in two groups. Group A, that Bluem oral gel was applied to periodontal pockets after scaling and root planing. And Group B, the chlorhexidine gel was applied to periodontal pockets after scaling and root planing. And the results show the reduction of probing depth in both groups after 3 and 6 weeks. And the authors conclude that Group A, Bluem group, showed better potential in reduction probing depth. It shows that oxygen therapy is an important adjuvant therapy for periodontics. But remember, scaling and root plane, supra and subgingival scaling and root plane are fundamental before use that adjuvant therapy, okay? And this clinical research published in 2023, it's a very important research for Bluem group. It was published in the Journal of Periodontology, one of the most relevant journals in periodontics. This study evaluates the use of Bluem gel associated or not with the laser in the treatment of residual periodontal pockets and diabetics patients. And the results were very good. Both the treatment control the disease in the same control. This proves that Bluem is good to adjuvant therapy for the residual periodontal pockets and diabetic patients. The third research is about the effect of oral gel on subgingival biofilm. This article proves that oral gel has bactericidal action and that acts better than chlorhexidine on red complex biofilm. And we know that red complex biofilm is the most aggressive complex, okay? So this research is very important and prove bactericidal action for oral gel. The fourth research is a clinical study that compared toothpaste, Bluem toothpaste versus toothpaste with triclosan in the treatment of gingivitis. This research were conducted by me and by my team on dental study. This article is already published. The inclusion criteria were: the students stopped to brush their teeth for 20 days. Yes, 20 days. To establish gingivitis. Probing that is smaller than 3 and attachment loss is smaller than 2. And all students overall good healthy. All participants received a soft toothbrush and hygiene guidance. Okay, the results. We observed that there was a reduction in gingival index and plaque index in both groups, with no statistical difference between them. The total bacterial counts significantly decrease in both groups too. And here we have an important conclusion. Both kinds of toothpaste are effective in controlling plaque and in controlling gingivitis. Okay, this research were made with Bluem toothpaste. This is an important conclusion too. So, it has been proven that Bluem toothpaste is a good indication for daily use. Your characteristics were fluoride and triclosan-free, without laurel, fight bad breath, neutral pH, and low abrasiveness index. This is important, less than 30 RDA, okay? This is a good characteristic for this product, for Bluem toothpaste. One more research now with mouthwash, Bluem mouthwash. The mouthwash don't have fluoride 2, don't have triclosan, don't have chlorhexidine, okay? And don't have side effects, okay? This is important. When we compare with chlorhexidine, the Bluem mouthwash don't have any side effects. And because this, okay, the indication are daily use, rinse every 8 hours. The substantivity of the products are 8 at 8 hours. Recommended for adapting the oral environment. Indicated for pre, trans, and post-operative in all situations. Suitable for all dental specialties. Have bactericidal action and helps the healing process. Okay, this is a principal characteristics of these products. And we have a clinical research to evaluate the effects of Bluem mouthwash on oral surgical wounds. The conclude that this study is Bluem mouthwash have a positively influence in tissue healing by reducing pain and in the post-surgical inflammatory process. Okay, it's an important conclusion. This mouthwash is antiseptic, bactericide, help healing, and don't have side effects. Here, we have another important research recently published in 2023. The results and conclusions show that Bluem mouthwash showed antibactericide activity against Streptococcus mutans with low levels of cytotoxicity. Okay, don't have cytotoxicity. Low levels. And Bluem mouthwash serve as alternative agent for oral biofilm control. we can don't use more others mouthwash and change for Bluem mouthwash because it have a good results, a good characteristics, and don't have side effects. Okay, now let's see some clinical cases, not more research, but clinical cases using the Bluem product. Okay, let's start with the first clinical cases using the gel, oral gel. The use of oral gel here, in this case, for the treatment in periodontitis. Okay, the patient was diagnosed with localized periodontitis in distal of canine during orthodontic treatment. The diagnosis was with probing depth with 14 millimeters. It's a big probing depth, okay? But only in your canine. The treatment plan was sub and supra gingival scaling and root planing, plus oral hygiene guidance. This is very important. We do this plan first that we use the oral gel. And after this, we do the application of Bluem oral gel inside the pocket. For this case, we prefer take the patient in our office and apply every day the Bluem oral gel inside the pocket. Okay, the first application was immediately after scaling, and the gel, it's important, can maintain it inside the periodontal pocket, and patient went home. On the second day, patient returned only to receive a second application of gel put inside the pocket. And the third day, the same way. The patient received the gel inside the pocket and go home. And after 30 days, it's have amazing results, excellent result was obtained. The periodontal pockets reduced from 14 millimeters to 3 millimeters. This is incredible. I'm a periodontist until 20 years ago, and for me, this case is amazing. This result is amazing. One periodontal pocket to 14 millimeters reduced in only 30 days to 3 millimeters, okay? In this case, we can see that the effective of oxygen help healing. The second clinical case is about the treatment of young female patient diagnosed with periodontitis, generalized periodontitis. Now we have a new classification, and this periodontitis is stage 4, grade C, very aggressive periodontitis, okay? Here on the radiographic, we can observe the loss of some teeth, condensed teeth, and the presence of extensive bone loss. The patient reports that she did not want to lose any more teeth, okay? And for this case, clinically, we saw periodontal pockets of 4 to 9 millimeters were detected in all sides with bleeding on probing or active periodontitis, okay? The treatment plan was the same. Sub and supragingival scaling and hood planing. And after we apply, application of Bluem gel inside the pocket, okay? We recommendation keep the oral gel in the periodontal pocket. It's not a recommendation, it's not a protocol, I'm sorry, but a recommendation. And I do this in all my patients after scaling and hood planing, okay? This patient received the oral hygiene instruction and recommendation to use Bluem toothpaste and mouthwash and raw at 8 hours, okay? The patient returned on the second day and received the second application of oral gel and go home. Patient return on third day, and we can now observe the clinical improvement of the tissue, okay? Only with 3 days. And the patient received the third application of oral gel. The gel is always kept inside the periodontal pocket. And patient returned on 40 days, and here we can observe healthy tissue appearance only with 4 days. And the patient received the last application of the gel. Então, 4 days consecutively, the patient come in our office and receive the gel after scaling and hood planing, okay? Here we have the reevaluation visit after 45 days, and we can observe the health periodontal tissue and good oral hygiene in the patient. Collaborate a lot with us in these cases. This is very important. Patient need have a good collaboration. And here we have the follow-up with 60 days. The patient don't have, more bleeding on probing. The periodontal pocket have been reduced, and note that the periodontal tissue is healthy. This is an excellent result too. Use the combination of traditional treatment plus Bluem oral gel, okay? But this protocol change. Our recent protocol, my protocol today, we no longer ask the patient to come to the office every day. My current protocol is do the hood scaling with ultrasonic or curettes, hood planing with curettes, irrigate the periodontal pockets with mouthwash, apply the gel inside the periodontal pocket and keep the gel inside the periodontal pocket, and the patient use a combination with a toothpaste and mouthwash and oral gel at home, the 8 in 8 hours, okay? Então, this is my currently protocol, okay? And we can see in this video this protocol, okay? Let's continue. In this third clinical case, we will show the use of gel in the treatment of furcation defect. for decontamination of furcation defect. Here, we look to 3 months after scaling and hood planing. And at this moment, it was decided to perform surgical treatment for grade 2 or class 2 furcation defect, because only this site stay with active periodontitis, okay? Então, after 3 months of conservative treatment, decided to perform surgical treatment. After full thickness flap and hood scaling, we do the confirmation of the presence of class 2 furcation defect. Now, we did the application of oral gel with the objective of performing chemical decontamination, local chemical decontamination. This is the secret of Bluem products. Release oxygen. We have oxygen in our hand, and we can use topical oxygen therapy, okay? The gel is maintained for about 2 or 3 minutes, and then it's removed with saline solution. After the furcation defect was filled with bone graft, bios, and the connective tissue graft was used as a membrane, and the flap was sutured in coronal position. Here we have 6 months of follow-up. The probing shows that have less than 1 millimeter of horizontal bone loss. And radiographically, there was bone formation inside the furcation defect. Okay, this is a good result too. Here we have the X-ray before and after treatment with 6 months of the follow-up. I believe that furcation defect need and have treatment. Okay, this is important. Maybe some colleagues think the teeth have furcation defect and extract this teeth. In some cases, it's not necessary. Okay, this is an excellent result here too, using Bluem to decontamination, chemical decontamination, plus bone guide regeneration. Okay. Other clinical case, we will talk about periimplantitis. Here we have a patient was diagnosed with periimplantitis. Bone level greater than 3 millimeters, probing depth greater than 6 millimeters, plus bleeding on probing. And the treatment plan was surgical treatment plus mechanical decontamination plus chemical decontamination plus guide bone regeneration. Okay, let's see. Here, after the full thickness flap, mechanical decontamination was performed with curates and bicarbonate jet was applied and implant. After this, chemical decontamination was performed, use Bluem oral gel. Here we can see the first application, and the application gel stay for 5 minutes. Look this image, this is incredible. We can see the bubbles. Here, the oxygen begin release it. This happens seconds, 5 or 6 seconds after application the gel. The gel was washed with saline solution and a second application was made for 5 minutes. In this case, it was chosen to apply 2 times because the area was very contaminated, okay? But you can apply only 1 time, no problem. After application, after 5 minutes, the gel was washed with saline solution. And today we know that the main treatment for periimplantitis is decontamination. For success of treatment of periimplantitis, we need to have a good decontamination. We can associate mechanical and chemical decontamination, how you can see in this case, okay? After the defect was filled with bone graft by us, associated with PRF membranes. The flap was sutured in coronal position. And here we can see the initial X-ray and the clinical situation with 1 year of follow-up. Okay, and I want emphasized that the last 2 cases, furcation and periimplantitis, the Bluem gel was indicated as an auxiliary method in decontamination. Okay, an auxiliary method in decontamination. One article was recently published using Bluem oral gel for decontamination surgical treatment of periimplantitis. Here we see the radiographic follow-up at 1 year compared to the other X-ray. The results was excellent. The professional shows the bone gain, okay? The protocol used was surgical treatment, open the flap, remove granulation tissue, apply gel for 2 or 3 minutes, wash the gel with serum or saline solution, apply again 3 times and stay for 2 or 3 minutes and close the flap. Here, the authors don't use bone, only the gel, okay? And the patient apply the gel 2 or 3 times at home. Patients use mouthwash too, okay? And the conclusion was the application of topical oxygen therapy can be very effective. The case demonstrated good results with maintenance of periimplant bone level and absence of clinical signs of inflammation. Good results too. And here we have a video showing that we can use mouthwash and gel in the no-surgical treatment of periimplantitis for initial decontamination. Okay, look the video. The protocol is the same. We need to remove the granulation tissue. We can irrigate the periodontal pockets with mouthwash, and after we can apply the gel and maintain the gel inside the pockets. Okay, and here I have one more cases of periimplantitis that we have 9 millimeters initial probing depth and associated with bleeding on probing, suppuration on probing, and bone loss. Okay, look to the tomography. My protocol for this case was granulation tissue removal, mechanical decontamination with bicarbonate jet, chemical decontamination with mouthwash apply, irrigate the periodontal pocket, and after, apply the oral gel. And keep the oral gel inside the pocket. I recommend the use of the gel and mouthwash 3 times a day for patient for 15 days. And after 30 days, we see an excellent result. When we compare the initial probing depth and after 30 days, we have 4 millimeters reduction in probing depth without probing on bleed or bleeding on probing. Okay, this is amazing. And here in this case, I made the follow-up with the patient, and until in this moment, we don't do nothing more, only this treatment, and the patient stay stable with these results. Okay. Now let's move on the lasted clinical cases. These clinical cases, we will talk about the use of oral gel helping the post-surgical complication. Okay, here we have a big complication, the flap descents. 4 days after guide bone regeneration surgery, the patient come back to the office with pain, and we show this necrotic tissue, okay, caused by tension in the suture. The treatment plan was remove the necrotic tissue. It's very important. The Bluem don't act good on necrotic tissue. It's very important that you remove the necrotic tissue. And in this case, the application was every day made in the office. We made 3 applications in the gel for 10 minutes each. No suture was performed, only application of Bluem gel day after day with clinical monitoring and daily photos. In a third image above, we visualize the appearance of the tissue 1 day post-operative. After 2 days in the vestibular region, there was already a healthier, more alive, and more vascularized soft tissue aspect with migration of epithelial tissue. After 3 days, the good clinical evaluation continues. And within 6 days, look to the picture, a significant clinical improvement in healing. By second intention was observed, okay? And this improvement was observed day after day, as we can see in this picture, in the picture sequence. 16 days after, the wound was almost completely epithelialized, and with 21 days, the wound was closed with health peri-implant tissue. This case, for me, have an excellent result. It's amazing, okay? It's amazing. And the last case, we will talk about help healing too, but the case is about osteonecrosis, medication-related osteonecrosis in the jaw, the mironge, okay? Here, the objective of this case is describe the treatment of osteonecrosis on the jaws with topical active oxygen therapy. Use Bluem oral gel. 6 months after implant remove, there was no healing, and the diagnosis was osteonecrosis. It's a critical case because the patient is older and have pain, and the region don't have healing, and the treatment plan was remove the necrotic tissue and apply the oral gel. And the patient continue using the gel at home 3 times a day. And look to the picture. This is amazing. After 16 days, only 16 days, good healing is already observed. Okay, and the patient have been controlled with 2 years. And after 2 years, a new implant was installed. And we recommended to the patient use Bluem oral gel in the all-time post-operative, okay? Because the first problem with osteonecrosis. Another product is the oral fluid. Oral fluid release 2 times more oxygen than the mouthwash. Don't have fluoride, alcohol, xylitol, and the recommendation is for use is mainly for cancer patients. The fluid is recommendation to use 3 to 5 times a day. It's a good product, and the patient have a comfort after use the Bluem fluid. And here we have a clinical case about a patient with oral mucositis, and the patient used the oral fluid daily and showed a significant improvement in the lesions, improve his quality of life. The patient have difficulty eating, and after use the fluid, the patient have a good results and improving his quality of life. It's a good product for this consideration. Okay, and the last product that I want to present to you is the oral foam. Oral foam have a specific indication for moisturized gums and oral mucosa. It's indicated too for patients that have home care and to cleaning aligners, plates, and complete dentures, and don't have problem to slowing. Then you can use and go sleep and don't have contraindication to slowing. You put in your aligner and put in the mouth and stay the foam there. Okay, foam is used 3, 5, 4 a day. What do you need? And the use helps keep aligners clean, and the patient have less gum inflammation and less bad breath. This is important information. And to finalize our presentation, I want to reinforce that Bluem products release oxygen, slowly release. The secret is slow release of oxygen and lactoferrin too. And the products don't have side effects. All people can use, children can use, have bactericidal action, have healing action, help healing process, and they are no toxic products. Okay, we have a research, but not were published yet. But all products don't have no toxic characteristics. Okay, and now I want to say thank you very much for your attention. I believe that I put in your mouth this new mindset, the use, the characteristics and the indication of Bluem products. Okay. And if you have any question, please contact me. Here are my contact details, and I help you if you want. Thank you very much, and see you in next time. Bye bye.